everyone, welcome to another episode. This is Dr. Kamran Aghayev, and in this video we'll be talking about lumbar disc herniation. If you suffer from disc herniation in your lumbar area, or if you have a friend or a family member who is affected by this disease, you know that there are many treatment options available for this disease. Physical therapy, chiropractic manipulations, various injections, acupuncture, radiofrequency ablations, laser ablations, ozone treatment, surgical treatment, and the list goes on and on. So it is easy for a patient to get distracted and confused and get lost in all of these options and not be able to come up with the best treatment. Therefore, in this video, I'll explain various treatment options available for lumbar disc herniation. First of all, lumbar disc herniation is not a disease itself. It's a consequence of a main disease, namely disc degeneration. This degeneration does not always lead to disc herniation. Lumbar disc herniation is one scenario out of many of this degeneration. In some cases, this degeneration can progress in a slightly different way, and disc herniations may not develop at all. In order to understand lumbar disc herniation, first we must understand lumbar disc degeneration. Basically, the spine consists of vertebral bones and disc joints between them. Most of bones in the human body are connected with each other with joints. Spine is not an exception. These disc joints provide mobility to the spine and connect the neighbor bones. In order to understand lumbar disc degeneration, we should look closer to the disc joint. Basically, it has two parts. The outer part is called annulus, and it's a fibrotic strong tissue which basically encloses the inner part. The inner part, or the core, is a soft gelatinous tissue called nucleus. The nucleus is a specific type of cartilage, very rich in water, and it's very, very elastic. It pushes vertebral bones apart and maintains optimal distance between them. It is like a spring. There is a high pressure inside the nucleus. You may remember that the force equals pressure times the surface. So the higher the pressure, the higher the force. Basically, normal high pressure inside the nucleus is absolutely necessary to spread the vertebra apart. Without this pressure, vertebral bones will collapse on each other. Unfortunately, in some cases, the nucleus gets damaged. We do not fully understand the process, but we do know that it is associated with mechanical load. If you put too much mechanical stress on the disc, the nucleus will degenerate faster. Smoking is also an important risk factor. People who smoke develop lumbar disc herniation more frequently than people who do not. So, what happens during nucleus degeneration? Well, basically, the healthy nucleus, which is rich in water and very elastic, gets dry, wears off, and breaks apart. There are many molecular cascades and mechanisms in this process which we'll not cover, but the main point is that the elastic healthy nucleus becomes dry, shrinks, and breaks apart. So as a result of degeneration, the nucleus may become fragmented. These fragments lose connection with the main part of the nucleus and migrate, or in other words, move out. They pierce through the annulus and move out. This condition is called lumbar disc herniation. Herniated discs usually compress the nerves, and those pinched nerves cause significant pain and neurological deficits. So basically, you can see now that lumbar disc herniation is not an independent disease. It's a consequence, one of the possible consequences of main disease, which is lumbar disc degeneration. So, can we treat lumbar disc degeneration? Basically, no. Lumbar disc degeneration currently has no treatment. We cannot implement any treatment to restore the degenerated disc make it healthy again, and cure the disease. So why do we have so many treatment options for lumbar disc herniations? Well, the main reason is that these treatments are not even aiming at treating the herniation or degeneration, and we will discuss most common treatment options. Physical therapy and chiropractic manipulations. PT or chiropractic manipulations use several external methods to diminish the pain associated with disc herniation. They cannot stop or reverse this degeneration. It cannot shrink or eliminate herniated parts. So it is unrealistic to expect that physical therapy or chiropractic may cure the disease. They can provide temporary relief at the best, but on the long term, they are not effective at all. Steroid injections. There are various types of steroid injections into spine. Most common types are interlaminar or transforaminal steroid injections. The basic idea is to put steroid in the vicinity of the compressed nerve. Steroids are very potent anti-inflammatory agents and significantly reduce the pain and inflammation associated with the mechanical pressure on the nerves. But do they treat the degeneration? No. Do they diminish or shrink the herniation itself? No. So they can provide only temporary relief at the best. Radiofrequency ablation or RFA. There are several types of radiofrequency ablations, but they can be divided into two main groups. The first group includes radiofrequency ablation of the facet joints. Basically, RF needle is inserted into the facet joint or in around the facet joint, and the tip of the needle is heated. To heat up the needle, the current is placed through the needle, which causes heating and damages the soft tissue, and that's how it works. So basically, you should understand that radiofrequency ablation is based on an idea of heating small portion of the tissue around the tip of the needle and damaging the tissue. The idea is to damage and permanently destroy small nerves in the facet joints or around the facet joints so the pain will go away. Another version of RFA is RFA of the disc joint when the needle is placed inside the disc joint. Does radiofrequency ablation of facet joint has anything to do with the disc degeneration and disc herniation? No, it does not. Does radiofrequency ablation of the disc affect the degeneration? Yes, it does. It makes it worse. Because RF damaged the nucleus, which has already been damaged. So RF ablations, at the best, can provide only temporary relief, but on the long term, they damage it. Lumbar discectomy. Lumbar discectomy is a surgical procedure. There are many types of discectomy, like open, microdiscectomy, endoscopy, percutaneous discectomy, but they're all basically the same. During the surgery, the surgeon removes the herniated part and relieves the nerve from the mechanical pressure. In addition to that, very often the surgeon also goes into the disc joint and removes the part of the disc joint to prevent the herniation in the future. Well, does this surgery treat disc herniation? Yes. Does it treat lumbar disc degeneration? No, it does not. In fact, by going into the disc joint and removing part of it, the situation gets worse. After the surgery, the patient usually feels better in terms of nerve pain, but the back pain persists. And in some cases, the situation may recur. And we call it a recurrence. In some cases, the lumbar stenosis may develop at the operated level. Lumbar discectomy can provide benefit for some patients, but not all of them. Basically, there is no way for us to tell which patient will be cured for the rest of the life and which will have a relapse in the future. But we do know that overweight, tall, and smoking patients have higher chance of unsuccessful outcome. The risk of recurrence is proportional to time after surgery because this degeneration is a slow, time-dependent process. To put in perspective, lumbar discectomy is effective at treating lumbar disc herniation, but not effective at all in treating the main disease, which is degeneration. Lumbar fusion. This treatment strategy employs a completely different approach. Basically, the idea is to permanently freeze the affected disc joint. During the surgery, the surgeon first removes the herniation, then goes into the disc and removes the degenerated nucleus completely. Then he inserts a cage and bone graft into the disc joint, and after that, the screws and rods are placed into the spine. So, as a result of the procedure, after some time, the disc joint completely disappears and is replaced by bone bridge that connects the vertebral bones. Therefore, the procedure is called fusion because the surgeon aims to fuse or unite the neighbor vertebral bones. It's a misleading name because the surgeon does not fuse the bones. He just makes everything ready for bones to fuse together later. Fusion is a biological process which may be successful or not. If it's successful, we can tell the fusion has happened and the neighbor bones united together and the procedure is successful, and so on and so on. But in some cases, fusion may fail, resulting in unsuccessful outcome. We call it pseudofusion or non-union. Many factors affect the success of the fusion, but surgical technique is the most important of all of them. In conclusion, lumbar disc herniation is not an independent disease. It's a consequence of lumbar disc degeneration that we cannot treat. None of currently available procedures can treat lumbar disc degeneration itself. Most of the treatments focusing on treating the consequence of degeneration. Lumbar fusion can treat the degeneration by eliminating motion and providing fusion at the operated level. Thank you for watching this video, and I will see you in the next one.